Dr. Seshmi's page. She's already shared it. How are you doing this morning?
I'm very good as always, Apoku. You know how I am. I'm
Yeah.
always bright and cheery and happy and just being optimistic. I'm
Well,
not
I
going to let
noticed that
any.
you're always happy. You're actually a very happy woman, which is really good.
Yeah,
I like happy people.
exactly. You can't let anyone affect you, Apoku. Things happen, situations happen, life happens. I think what I've learned is you just really need to be resilient and believe in
Absolutely.
yourself. I think it's really important for each person to remain positive and also to have that self-belief in yourself, because not everyone will want the best for you in life, and also it's difficult sometimes. You have to
Yeah.
deal with so many different people, so it's just part of life.
It
And
is part of life. Yeah.
I
Yeah.
think being resilient, just remaining positive and believing in yourself is so important, especially now with the COVID-19. We know so many people are faced with so many challenges. Day in and day out, people are being affected with what's going on around them, with losing jobs, with relationship problems. Domestic violence has increased. We know people have lost loved ones because of grief. So, mental health is so important. And that's why I started off with that. I think it's
Okay.
important to remain really happy and positive and optimistic as much as possible, which we're hoping, especially with the COVID pandemic, that things are going to get better in the next few weeks.
Well, talking about things being better and all that, there's this news that just jumped
Yeah.
at me earlier on when I was researching, and I like for us to do that first before we come to what's going on in the United Kingdom. It's in the state of Texas in the United
Wow.
States.
Yes.
They're saying that Texas will lift its mask requirements and allow businesses to reopen at full capacity next week. The governor, Greg Abbott, has announced it is now time to open Texas 100%. He said, and don't forget that Texas is the largest U.S. state, and it's about to end. They're about to end their mask requirement and open the economy full time for business. Well, they're saying that because the numbers have dropped significantly in America and especially in Texas.
Yes. That is amazing, that they're doing that.
It's amazing, yeah.
Yes, I mean, that is
In
really.
fact, on Tuesday, yesterday, the president said, President Biden said that the U.S. was on track to have enough vaccines for every adult in the country by the end of May. So that's quite good, isn't it?
That's good news. And I think a lot of countries are following with that, in terms of reducing lockdown. Even in the UK, hopefully, we'll start to see more easing of the lockdown measures, with schools starting on the 8th of March. And then obviously, other businesses opening, and people being able to socialize with at least one person outside in the park, for coffee. So, I think more and more people are starting to go out, and the lockdown measures are going to be reduced. The headlines today is still obviously, they're saying the UK reports another 343 deaths with 6,391 cases. So we're obviously still seeing cases, but definitely, I think it's all reduced by three quarters, in terms, three quarters, or I would say four-fifths, in terms of the numbers that we are seeing compared to what we were seeing before.
Okay. Now, well, let's back to the UK. I mean, you've already started talking about the UK
Yeah.
now, and so we might as well just do it.
Yeah.
Now, what's a bit worrying to me is the fact that some international arrivals to the UK have waited as long as 9 days, and I can testify to that. It's not me because I haven't traveled.
Yeah.
But my friend who came from Africa last week.
Yeah.
Speaking to him as of yesterday.
Yeah.
He still hasn't received his kit. Even though he paid the £210 before he flew, you cannot fly without paying for the test kit. And he flew with his daughter, so he had to pay it double. But they haven't received it. And they're self-isolating.
Well, that's what the reality is. I mean, it's unfortunate that your friend had to go through that. But that is what the BBC News is saying, is that UK arrivals still waiting for quarantine COVID tests. So that is a bit disappointing, because you would think at now at least testing would be so robust and would be so efficient and effective, that they'd be doing it really quickly, and that people will be getting tested much more easily. So, but it seems like obviously that's not happening, which is a bit of a surprise, I would say.
Yeah, it's a surprise and it is a concern,
Yeah.
And people, the company um, that sell the kits or what, like they're the main people who do it. They're called corporate travel management.
Yes.
And I'm looking on the news article here on their website, people are complaining. People have posted comments complaining about delivery delays and all that. So it's not nice.
Yes, I mean, what they're saying is that the test should be done between the 2nd and 8th day of the day of isolation, but people are waiting up to 10 days and they still haven't got their test. And like you said, your friend.
My friend hasn't even got his first one. I remember when he arrived, and then 2 or 3 days later, I phoned him and I was in a chat with him. I asked him, "Oh, have you got your kit yet?" And he said no. And then he said to me, "Well, this is the 3rd day, but hopefully we'll get it today or tomorrow."
Yeah.
And he still hasn't got not even the first one.
Yes, I think it's difficult because if people are coming back into the country and then having to isolate and then needing to do testing, because they won't be let out of isolation in quarantine unless they have a negative testing. So obviously there's a delay in getting the test done. It's going to cause a lot of problems. We must also bear in mind that even to just stay in isolation, I think I've read something like, is it £1,750 that they have to have to actually accommodate themselves in the hotels
that applies to those on the red list. The 33 countries that are on the red list. So that if you're coming from those countries, then it's compulsory that you pay £1,750 because you will be walked straight into a hotel room and you will have to self-quarantine there. And whilst you're there, the same testing rules apply to you. You get on the 2nd day, you get a test, and then on the 8th day, you get a test before you come out on the 10th, after the 10th day. But you'll have to pay £1,750 for your hotel accommodation and plus the tests and everything.
Yeah.
The transportation and everything. But on the other hand, the other travelers who are not coming from the 33 red listed countries, you can go home, but you'll have to stay at home for 10 days, and you'll have to go through that the test kit situation, like in the 2nd day and then the 8th day. Unfortunately, some of them, as we see on the news, and as my friend has told me, they haven't received their test kits yet. So I'm wondering, what's going to happen? What if they walk out after 10 days? They obey the rules and stay in for 10 days, and they walk out after 10 days. They have a case, because you can't stop them from going out after 10 days.
Well, that's what I was going to come to, is that it's because of, I mean, the reports are that people are expressing frustration and concern. And also, like you said, that, if the 10 days has finished, or the 14 days, however long they're supposed to, because of whichever country they've come from, that's on the list, then it's going to cause a lot of problems, because we're going to see more and more people going on holidays and also going on business trips. We know that holiday season is starting, and more and more people are going to be going on these holidays, and we're going to be faced with many more people in this situation. So my concern is, obviously, on the one hand, people are frustrated, they're having to wait for tests, there's a delay in testing, but on the other hand, this is going to escalate. The numbers are going to increase, because a lot more people are traveling, and a lot more countries will be allowing people to travel, because as it stands, I think still a lot of countries are closed to the UK. Especially because of the UK variant, and it's not only in UK, it's in US, in South Africa. All other countries are doing the same. I was speaking to a friend that she's going to go to Malaysia sometime this year, but at the moment the borders are closed to the UK. So there's lots of things going on the horizon in terms of the travel. But I hope this gets sorted out because I mean, I can understand how frustrating it must be for your friend, having to be in isolation, in quarantine with his daughter, and then not being able to be let out. But yeah, I mean, if people have to go back to work, I'm not sure what's going to happen, because if they only have certain amount of days of leave and then they need to go back to work, how would that work?
Yeah, fortunately, my friend's working from home, so that's not a huge problem. And his daughter is studying as well, from home. Anyway, so let's go to the next story. Let me read it verbatim here. People with low immunity due to health conditions, including cancer, are being recruited to a study to urgently find out if coronavirus vaccines will still offer them high protection. So as the UK comes out of lockdown, it is important to know the virus risk for all populations. So trials and real-life data show the shots work very well for most adults, including the very elderly, but there is little evidence on efficacy in immunocompromised patients. What does that mean? What does the whole story mean, Dr. Seshni?
So it sounds like they're looking to recruit, obviously, people in the high-risk groups and the more vulnerable people. So I think that's what it's probably, that's what I understand. That's what they're trying to do. So yeah, I think probably they're looking at more vulnerable people and people that are immunocompromised to actually do some trials, isn't it?
Yeah, well, yeah, that's what it says here. But I thought, I had the impression that they've done tests on these people already.
Yeah. Yeah, well, I think they would have done testing, but maybe not everyone has had testing. So I think they're probably trying to just do. So I think with obviously with what's going on with the COVID-19, I think they're probably just making sure that I think what I'm reading about this is that it's obviously has affected the cancer treatment trials. So because of the COVID-19, a lot of people have obviously been affected, those with cancer. So that's why they're saying that this is apparently the worst affected groups. So being immune compromised, which is one of the most common effects associated with cancer and its treatment, was identified early in the pandemic as a comorbidity. And so these patients were subjected to extreme lockdown and shielding measures. And what has happened is there's been a lot of drug trials in cancer treatment, which has halted and delayed. And that's why they are concerned about this disruptions, because as you know, cancer patients would have needed these medications, but because it would have caused them to become immunocompromised because of the medications, what has happened is all these trials were stopped and halted, so which obviously affected the course of whatever treatment they were supposed to have, and also the cancer. So I think there's obviously a lot of concerns, Apoku, in this group. So they were high risk groups, they were had to shield, and on top of that, their treatment had been stopped or delayed. So they're doing more research on that to compare. They're doing a lot of research to find out more about the mortality, especially, and the impact of the COVID-19. But it seems to be that this is still a concern. I think the cancers of concern is obviously lung cancer, breast cancer, and a few others. But I think overall, I mean, to be honest, I was speaking to a colleague that's an oncologist, and he was reporting the same thing, that they were inundated with a lot of cases, a lot of people that they've had to follow up. And I think for me, it sounds like it's as the impact of COVID-19. And I think what I was trying to understand was, on one hand, a person has a diagnosis of cancer, supposed to have treatment. Now all of that is delayed and halted. And then on the other hand, there's a lot of anxiety and concern around COVID-19 and how that's going to impact on them because they're in the high risk groups. So if you can imagine, these are very high risk patients, very vulnerable patients. So it's good that they're obviously doing more testing and more trials. to actually establish what's going on.
That's fantastic. Yesterday we talked about the vaccine being rolled out in some African countries, or
yeah,
especially Ghana. Ghana was the first one, wasn't it?
yes,
So they rolling out the vaccine. They started from I think 2 days ago, or the
yes,
1st of March, when the president
yeah,
and the vice president and their spouses took their shots, and then they started rolling it out. Actually, yesterday I got a text from my sister, my oldest sister, to say that she had her jab yesterday.
oh wow, that is
She had
amazing.
her first jab yesterday, which is a good thing. Now, just after we finished the show,
Yeah,
I got news also that the Ivory Coast,
yes,
they're also
oh
rolling
wow,
out the vaccine the same day. And then another news came up that Nigeria, they're going to start theirs today. Now, I'm talking about Africa because, it's a place of interest for all
yes,
of us here in the Western world, because the vaccines, because of the COVAX scheme and everything
yes,
that's going on. But now this morning, the news is saying that more African countries have received their first batches of the coronavirus vaccines under the global COVAX scheme. Now, Kenya received over 1 million doses of the Oxford AstraZeneca vaccine on Wednesday, that's today, becoming the third East African country to benefit from the COVAX scheme. The doses are enough to vaccinate 500,000 people in the first phase. And frontline health workers, of course, teachers, police officers, and the elderly will be the first. Now, in the Democratic Republic of Congo, the health minister was at the airport on Tuesday night to receive 1.7 million doses of the AstraZeneca. Now, in Angola, they've received 624,000 doses of the vaccine, and so on and so forth. So it looks as if Africa, they're taking really good strides in acquiring the vaccines. And one thing I know for sure, because I followed it from 2 or 3 days ago, there's a massive move in educating Africans who, with all the conspiracy theories going on, and a lot of African countries are saying, we're not taking it. People citizens are saying we're not taking it. And so there's been this huge campaign educating people that the vaccine is not going to kill you. It's actually going to help you. And it's happening with governments, with schools, with places of worship. They're doing all this massive campaign in educating people on the benefits of receiving these vaccines. Actually, sorry, I'm talking too much, but I just remembered also that my sister has a school. Her and her husband, they own a school, and she said she got a phone call from one of the parents just yesterday to say, please don't vaccinate my child. So my sister said, what are you talking about?
yeah.
So, yeah, but I hear that they're vaccinating all children. No, that's not true at all. So, all this miseducation is going on and on and on in Africa, but fortunately, things are changing.
Well, it's quite positive news. It's great to hear that your family and your sister in Ghana have also, going to receive the vaccine, and that people are making plans. So it's really good to see in the African countries, Congo, Nigeria, Ghana, Angola, Kenya. South Africa has also started the vaccine rollout. So they're saying around the country at the moment, so this was the recent news, around the country, frontline health workers are getting the jab of the Johnson & Johnson vaccine. So, yes, so that's what they are saying. And more vaccines are expected from other manufacturers in March 2021 as the country prepares for mass vaccination. So there's a professor from the Department of Internal Medicine and University of Pretoria and Steve Biko Academic Hospital, Professor Veronica Uckerman, and who has said that this vaccination is rolling out. So South Africa is hoping to have at least 67% coverage, which translates to about 40 million people. So the Department of Health hopes to meet this target in South Africa by 2021. So
that's
they,
really good.
yeah. So at the moment, it's being rolled out with the healthcare workers, and then they're going to be going into the public sector. But they said that the Johnson and Johnson was rolled out, which is amazing news. So the phase one for South Africa is frontline healthcare workers. So they're targeting 1.25 million people. Um, Phase two is essential workers, people in congregate settings, people over 60, people over 18 years with comorbidity. And then phase three will be persons over 18 years old. So it seems like it's quite realistic, and they've secured Johnson and Johnson. They've secured 80,000 of that, and additional 20 million doses of the Pfizer end of March 2021. So it seems it's quite good actually.
Yeah, that is a good thing. And then also, let's quickly, before we do the numbers, I want to talk about the Black Nation minority, the BAME community here in the United Kingdom, and especially in our region, in our county, Bedfordshire, and of course, the counties near us, close to us, the Buckinghamshire, Hertfordshire, and all that. You remember Dr. Linus and Dr. Kuku,
yes,
who came on to talk to us about the vaccine?
Yeah. Yes.
Actually, they're going to be on a platform, on a Zoom platform, and it's not just them, but there's two more doctors. I'm trying to find I was trying to find the flyer so that I can talk about it, so that people can just join Zoom if they want to hear more about this thing. But I'll find it and then I'll announce it later. But yeah, they're going to be on the 6th of March, on Saturday 6th of March, I think from 7 p.m. They're going to be on a platform with other health officials, like the two more health officials, and it's going to be like a Q&A thing. People are going to ask questions, but I think it's mainly aimed at the BAME community, the Black, Asian, and minority ethnic community, because of what we're hearing and things that's going on about, I don't want to use the word resistance, but the fear, in better comments, the fear of the BAME community receiving the vaccines and all that. Yeah, so when I get the whole information, I'll just post it on our Facebook page, and also I'll announce it during the show, so that anybody and everybody can go on that Zoom meeting and listen and get educated.
Yeah, I'd encourage anyone to go on that. That sounds amazing, because definitely there are still conspiracy theories, there's still concerns, especially from the BAME communities and other communities as well, where people are still concerned about taking the vaccine. Yes, so I'm going to do the numbers because I'm just wary of time. So as of today,
I ask you to do that now,
yeah, as I know, I read your mind. So as of the 3rd of March 2021, we have 115 million people, 310,029 positive cases globally around the world. The number of deaths are 2,560,000 and 843 deaths. Total recovered in the worldometer is 91,132,785. In terms of the total recovered. Top 5 countries remain the same, with USA 29,370,705 positive cases, with total number of deaths 529,214. India number 2 with 11,139,516 positive cases, with 157,385 deaths. Brazil number 3 with 10,647,845 positive cases, with 257,562 deaths. Russia number 4 with 4,268,215 positive cases, with 86,896 deaths. UK number 5 with 4,188,400 positive cases, with 123,296 deaths. And then we'll come to South Africa is number 16 with 1,514,814 positive, 815 positive cases with 50,271 deaths. And then Nigeria 73 with 156,496 positive cases with 1,923 deaths. Ghana number 88 with 84,023 positive cases and 607 deaths. And then we know UK in the last 24 hours, we have seen 343 deaths in the last 24 hours. And Every Life Matters, and 6,391 new cases in the last 24 hours.
It's gone up a bit from yesterday, hasn't it?
Yeah, but that's what we've seen. We've always seen over the weekend. The first 2 days is still much less, and then later on we start to see the numbers. Yeah. Thank you so much, Apoka. I just want to say happy birthday to Heinrich Ferdinand's brother. It's his birthday today, and another friend. It was his daughter's birthday. She turned 2. Oh. It was her crown birthday, and it's his birthday today. So happy birthday to Heinrich Rensburg. And hope he has a fantastic day. And also another friend, Shannon, celebrates her birthday. So lots of birthday. And a friend of mine, Janita, one of my best friends, her daughter Sonali's. So quite a lot of celebrations today. And I hope everyone has a fantastic, fantastic day.
Right. Before you go, I just found what I was talking about, about the Q&A, the questions, about the vaccines and vaccination with Dr. Kuku and Dr. Linus, and they're having also joining the panelists is Dr. Bharathi Kumaravel, senior clinical lecturer of public health and consultant public health medicine. So she will be joining the panelists as a public health representative, and this thing is happening on the 6th of March at 7 p.m. on Zoom. They're asking that if you want to post any questions, you can do so now. Just go to the website surveymonkey.co.uk/r/862GT9Y, and you ask your question. I'm going to post that on our Facebook.
Yes, I definitely will share it and let others know as well, because there are lots of questions.
You can share it.
Yeah.
So that's what's going to happen, and it's at 7 p.m. So all the Zoom details will be on the HRB Breakfast page, and also on the Sunday Best page, and on my personal page, and of course I'll share it with you so you can share it.
I will also share it, and thank you to Dr. Linus and Dr. Kuku for doing that, because it's amazing.
Kudos to them.
To educate.
And the organizers of the Q&A, Santa Wede is the main organizer, and so to him and his team and everybody else who's doing this, I think you're doing an amazing job. Kudos to you guys, man.
Amazing.
Thank you very much, Dr. Sesni.
I know. I just wanted to say I'm going on the train today to London, so I will let you know. I'll feed back to you tomorrow how it goes. I'm going to the Light Center, the Sukiya Mahikari Center.
Oh, don't worry, you'll be fine. Just wear your mask.
And I know. Have you been on the train recently then?
No, I have not.
Yeah.
No, I have not.
Okay, so I'm going to wear my mask. I will feed back to you tomorrow, and the listeners as well, as to how the journey goes.
Let's see what's going on in London now.
Exactly, on my way to. Listen, have a fantastic day and lots of love to everyone.
Thank you.
Let's spread the love and not the virus. Thank you, everyone, for joining, and lots of love from me. Namaste, and have a fantastic day. Goodbye.